This video is for those people who want to achieve some anti-aging through a facelift but are really not sure whether they should go for the procedure owing to the prolonged recovery period of time or expense or whatnot. So, for these patients I offer two distinct procedures. One is a surgical facelift, one is a non-surgical facelift. A surgical facelift is typically done in an individual where the sagging is very significant. It involves putting the patient under general anesthesia and then opening the skin in hidden areas around the ear, and through these incisions we pull up the tissues to a higher plane and then remove the excess skin and tissues. This procedure involves a recovery period of about 2 to 4 weeks due to the swelling and bruising that occurs due to the procedure. This can be on a slightly expensive side, but at the same time the results are quite significant and also last for a pretty long period of time in terms of say 5 or 10 years or more in some people. A non-surgical facelift is performed in a person who is just beginning to sag, or the amount of sag is not really that significant to warrant a surgery. In this procedure we do not usually involve any major anesthesia, that is, we perform it in the outpatient department under local anesthesia. We use threads and fillers as a modality for this procedure. We use threads for the pulling effect and we use fillers to fill in the skin folds or grooves and also to achieve certain pushing effect. This pull and push effect does give a small amount of anti-aging or rejuvenating effect to the face. However, these procedures do not last that long. That means the person may have to repeat the procedure in about a year or so to still look refreshed. At the same time, these procedures are not as expensive as say a surgical facelift.